If you're a man over 65 who's been masturbating the same way for decades, you might be unknowingly damaging your health in ways that could affect your heart, your prostate, and even your longevity. No, this isn't about shame or judgment. This is about real medical consequences that I've witnessed in my practice for over 3 decades. I'm Dr. Michael Harrison, a board-certified urologist and men's health specialist who has spent his career helping older men navigate the changes that come with aging. What I'm about to share with you isn't discussed in most doctors' offices, but it should be, because the habits you developed in your 20s and 30s can become dangerous liabilities after 65. Before we dive in, if you're serious about protecting your health as you age, go ahead and hit that subscribe button and turn on notifications. You'll want to stay informed about the health insights that could make the difference between thriving in your golden years and simply surviving them. And if this message resonates with you, type 1 in the comments. If not, type 0 and let me know what health topics you'd like me to cover. Today, I'm going to walk you through 3 critical mistakes that men over 65 make when it comes to self-intimacy. These aren't moral judgments. These are medical realities that can silently undermine your cardiovascular health, compromise your prostate function, and even accelerate cognitive decline. The first mistake is one I see constantly in my practice, and it's happening right now in bedrooms across the country. Men who think that more frequent stimulation will somehow keep them younger are actually putting dangerous strain on their aging cardiovascular systems. Mistake number 1. Excessive frequency without regard for recovery time. I remember Harold, a 68-year-old retired mechanic who came to my office complaining of fatigue and occasional chest discomfort. During our consultation, he mentioned that he'd been engaging in daily masturbation because he'd read somewhere that frequent ejaculation was good for prostate health. What Harold didn't understand is that after 65, your body's recovery mechanisms slow dramatically. Here's what happens. Each time you reach climax, your heart rate spikes, your blood pressure rises, and your entire cardiovascular system works harder. In younger men, this is manageable, even beneficial. But after 65, when your arteries may be stiffer and your heart less resilient, daily stimulation can create chronic stress on your system. The research is clear. Men over 65 who engage in sexual activity, including masturbation, more than 3 times per week show elevated markers of cardiovascular stress. Their cortisol levels remain higher throughout the day, their blood pressure patterns become irregular, and their sleep quality suffers. This isn't about denying yourself pleasure. It's about understanding that your body needs time to recover between episodes of intense stimulation. The optimal frequency for men over 65 is typically twice per week, allowing at least 48 hours between sessions. This gives your cardiovascular system time to return to baseline and actually provides the prostate benefits you're seeking without the dangerous side effects. Harold made this adjustment, and within months, his energy returned and his chest discomfort disappeared. His cardiologist was amazed at the improvement in his stress test results, not knowing that the change came from something as simple as reducing frequency. But frequency isn't the only issue. The second mistake is perhaps even more dangerous because it directly affects the organ that causes the most problems for aging men. Your prostate. Mistake number 2, using excessive force or pressure. This is something most men never consider, but it's causing silent damage in thousands of older men right now. As this leads to difficult urination, pelvic discomfort, and sometimes even blood in the urine. The tragedy is that these men think they're doing something healthy for their prostate when they're actually damaging it. The prostate in older men is like a ripe fruit. It's full of function, but it's delicate. Excessive pressure can cause inflammation that takes weeks to heal, and repeated trauma can lead to chronic problems that require medical intervention. The solution is gentleness combined with proper lubrication. Your skin produces less natural moisture after 65, and attempting stimulation without adequate lubrication creates friction that damages sensitive tissues. A high-quality, water-based lubricant isn't just for comfort. It's essential for preventing the microtears that can lead to infection and chronic inflammation. One patient, a 71-year-old former construction worker, had developed such severe prostate inflammation from aggressive techniques that he required a catheter. When we addressed his approach and he learned gentler methods, his symptoms resolved completely within 2 months. The third mistake is the most overlooked, yet it may be the most dangerous of all. It's something that happens in the moments after climax, and most men have no idea they're putting themselves at risk. Mistake number 3, immediate physical activity or stress exposure. This is the silent killer that no one talks about. I've seen men have heart attacks, strokes, and dangerous blood pressure spikes because they didn't understand what happens to their body immediately after orgasm. Here's the physiology. During climax, your body releases a flood of hormones and your nervous system goes through dramatic changes. Your heart rate and blood pressure spike, then rapidly drop. Your body temperature changes and your blood vessels dilate. This creates a vulnerable window that lasts about 15 to 20 minutes. During this recovery period, your body is working hard to return to normal. If you immediately get up, start moving around, or expose yourself to stress, you're asking your cardiovascular system to manage 2 major challenges simultaneously. For men over 65, this can be catastrophic. I've treated men who had heart attacks within minutes of climax because they immediately got up to answer the phone or respond to some perceived emergency. Their hearts simply couldn't handle the dual stress of post-orgasm recovery and sudden physical demand. The solution is simple, but critical. After climax, remain still and relaxed for at least 15 minutes. Allow your heart rate to return to normal gradually. Keep a glass of water nearby because dehydration compounds the cardiovascular stress. And most importantly, don't schedule intimate time right before activities that require physical or mental exertion. This isn't about being fragile or overly cautious. It's about respecting the reality of your aging physiology. Your body is still capable of pleasure and function, but it needs time and care to manage the intense changes that come with sexual release. One of my patients, a 69-year-old retired teacher, started following this protocol after experiencing chest pain during his recovery period. He told me months later that not only did the chest pain disappear, but he actually enjoyed the experience more because he wasn't rushing through the recovery. These 3 mistakes are completely preventable, but it needs time and care to manage the intense changes that come with sexual release. One of my patients, a 69-year-old retired teacher, started following this protocol after experiencing chest pain during his recovery period. He told me months later that not only did the chest pain disappear, but he actually enjoyed the experience more because he wasn't rushing through the recovery. These 3 mistakes are completely preventable. You often find that the quality of your experience actually improves. Remember, optimal frequency is typically twice per week with at least 48 hours between sessions. Use gentleness and proper lubrication to protect your delicate tissues. And always allow adequate recovery time after climax to let your cardiovascular system return to baseline safely. Your health and longevity depend on making these adjustments. The alternative is risking serious complications that could have been easily prevented with simple changes in approach and timing. If this information has been helpful, please share it with other men who need to hear it. And if you're ready to take your health seriously in other areas, check out my video on the 3 vitamins every man over 65 needs for optimal energy and vitality. Your future self will thank you for the changes you make today. Until next time,